to recover the schedule because I have a very short presentation, so good for this time after lunch. So the abstract that I would like to present today, it's titled Clinical Predictors for Maxillary Canine Impaction, a novel approach using a multivariate data analysis. The ectopic eruption of maxillary canine is a problem frequently encountered in clinical orthodontics. With a prevalence of 1 to 3%, this developmental disturbance ranks second after the lower third molar. Maxillary canine impaction is complex in its etiology, localization, response to preventive treatment, and early prediction. A late diagnosis often makes the treatment more difficult. Therefore, to establish an early clinical and radiological control of maxillary canine eruption can be of great significance to predict the impaction. Of course, I'm not going to go through all these, but it is important to emphasize that several factors have been proposed as predictors for maxillary canine, related to unerupted tooth localization, dental anomalies, dental-velar relationships, craniofacial skeletal characteristics, and dental age. However, results are inconclusive and controversial. All these studies have used conventional univariate statistics, including no more than 5 variables in their analysis, which could have led to potentially inaccurate results. Therefore, the aim of the present study was to find possible predictive factors associated with maxillary canine impaction by using a comprehensive multivariate approach. This retrospective study included all patients referred for surgical exposure of impacted canines to Mölndal Hospital, Sweden during 2011. Age and gender matched orthodontic patients with normally erupting canines were used as a control group. The age range for both groups were 11 to 17 years. Data consisting of localization of the unerupted tooth in a panoramic radiograph, skeletal relationships in a lateral view, and dental-velar traits from a study cast were evaluated and entered in SIMCA by U-metrics. Multivariate data analysis is a powerful instrument for integration and interpretation of complex datasets, which copes with the problem frequently encountered with conventional statistics and provides informative diagnostic and graphic tools that facilitate the interpretation of data. Results displayed a clear separation between the impacted and the control group. Multivariate data analysis indicated that variables related to the localization of the unerupted tooth are highly correlated with the impacted group. And as shown in this figure, vertical level, angulation to the midline, and sector localization offer the greater influence on the prediction of impaction, with canine localization in the more mesial sectors substantially predictive. Lateral distance and angulation to the occlusal plane showed a negative correlation towards the impacted group. The assumption that impaction can be related to a slower rate of dental development requires further study on a larger group of patients. Neither skeletal relationships nor specific dental-velar traits were correlated to the impacted group. This is a different way to visualize the same results. On your left side, we can observe the variables associated with the impacted group, including vertical level and angulation to the midline. A strong correlation of sectors 3 and 4 is observed in the impacted group. These significant differences between impacted and non-impacted canines are useful in the understanding of impaction and the patterns of eruption and prediction of impaction. As it has been shown before, the most influential features related to the impaction groups were related to spatial localization of the impacted tooth. In accordance with Erickson and Kudul and Warford et al., the degree of mesial overlap to the maxillary canine relative to the adjacent lateral incisor plays a key role in the detection of impaction. Power and Short reported less chances of eruption when a lower canine angulation to the midline was present. Sajnani and King found that the canine cusp tip to the occlusal maxillary plane was the most important predictor. Characteristics expressing sagittal and vertical skeletal relationships were not influenced by the impacted group. To finally conclude, the only factor that could be identified as a positive predictor for impaction using a multivariate data approach was the position of the impacted canine. Neither the profile X-ray analysis nor the static cast analysis is adequate to predict canine impaction. Non-clinical parameters potentially associated with the etiology of impacted canines, such as genetic factors, should be investigated in further studies. Thank you for your attention.
That was concise. Thank you. Okay.
It was
so
a 10-minute presentation.
do we have questions from the audience? Okay, I have a question.
Of course.
What about the sequence of eruption when you sometimes have a retained lateral or something, when there is a disruption in the eruption? Does this affect the etiology of having an impacted? Can you predict through
I
sequence?
No, it's just related to canines.
Just related to canines.
Yeah, because they have a specific etiology. It's a very controversial
Topic.
field.
Yeah.
And it depends on the localization of the canine, if it's buccally or palatal. But for this multivariate data approach, I think we are only focusing the factors affecting canines in that specific age.
So, and you think the number of cases you took in the study is enough?
It's enough for a multivariate data analysis, just for this type of analysis.
Okay. Thank you.